Well, I saw it as a constituency MP. I used to go around the nursing homes and residential homes in my constituency, and I could just see them getting bigger and bigger, and more people slipping into this sort of world of darkness. And I remember some sort of specific occasions where you could see a son in his 50s talking to a mother in her 70s, and she had no idea who he was, and you could see the heartbreak on his face. And you saw that so many times. And then it was that, plus, to be honest, it was sort of a slight sense of shame that I think I was one of many people who thought, well, dementia, it's what happens when people get old, it's just part of aging. It isn't. And when I came to understand, actually, this is caused by diseases of the brain, like Alzheimer's, and we're cracking cancer, we're cracking heart disease, we're cracking stroke. Why aren't we cracking these diseases of the brain? That's when it became a sort of passion for me as Prime Minister, and we did some good things, of doubling the research budget and making it a G8 priority, but we've still got a long way to go. This is, I think, the health crisis of our time, dementia. We're a country of 60 million people, and there will soon be 1 million people with dementia.
Are you hopeful this is a disease that we can treat?
The battle against these diseases is like a marathon race. You know, it's a 26-mile race, and if you look at cancer, we're probably in mile 18 or 19. Lots of cancers we now know how to treat and prevent, but we've still got some way to go. I think with Alzheimer's and the other diseases that cause dementia, we're in like mile 9 or 10. We will finish this race, we will get it done, but we've got a long way to go. When I first started on this, I think we were rather like AIDS in the 1980s. We knew this was a massive problem. There wasn't a cure, but massive amount of philanthropy and research and government action helped to get us there. And that's what we've needed with Alzheimer's and the diseases that cause dementia. Now, the breakthroughs recently are very encouraging. Some drugs that really seem to be reducing the build-up of these proteins in the brain that many scientists think are connected to Alzheimer's. The great thing about medical research is when you get one small breakthrough, you then get a huge amount of enthusiasm, and there are over 140 drugs in trials. So I'm hopeful, but there still needs to be government action, philanthropy, as well as the pharmaceutical companies coming in as well.
I want to come on to that. Is that hope, though, important? Because I think right now there's a sort of attitude amongst people that Alzheimer's may affect not to come forward, not to speak to their GP, not maybe even speak to their families, because the feeling is there is nothing to treat this disease. Do we need to get over that attitude of, is it a defeatism?
Yeah, we absolutely. I mean, like with all diseases, there's a period when there's a sort of stigma attached almost, and we need to get over that. We need more people to come forward. We need to have better tests and better diagnosis. And sometimes the diagnosis is wrong, and I know how bad that can be. And that's why one of the big things I'm working on is this early detection of neurological diseases, EDON, and what it's doing is basically bringing together tech and AI with science and working out that, of course, there are lots of fingerprints, lots of signals that you might be getting one of these diseases. It could be the way you sleep, or the way you walk, or the way you talk, or the way you use your mobile phone. So we're using mobile devices, things like Fitbits and headbands and telephones and apps, and collecting all these digital fingerprints because we think they will be the way you diagnose much earlier are people getting these diseases. Our aim is to diagnose Alzheimer's 10 to 15 years earlier than today.
Although there is a lot of hope for people with Alzheimer's, at the moment, arguably they're being failed by a social care system, and that's having a knock-on impact on our health service as well. Do we need to really focus on fixing the social care crisis? Yes,
I think there are two parts to this. There's one part which is how do you make the NHS and social care systems work better together. There's then a second problem, which is the cost of long-term care. That is what the Dilnot cap, so-called, the cap on care costs, which my government commissioned and looked at but didn't implement. That's what it's there to deal with. I still want us to do that, but I still come back to this issue of, it seems to me that is a classic case for where you should have some form of insurance to try and deal with these catastrophic costs. Now, the insurance industry hasn't been able to do that, and the conclusion I would come to is that government needs to form some sort of partnership with insurance, or perhaps even provide the insurance itself. There are precedents for this. Government did that many years ago to protect businesses from the catastrophic costs of terrorism. But on the other hand, if you ask general taxpayer to support the catastrophic costs faced by people who own their own homes, you're asking often less well-off people to pay in their taxes to protect better off people from losing their house. And that's why I think there might be an insurance answer, but I try not to get involved in current political controversies, but it seems to me that's something that we need to look at harder.
Putting the ball maybe a little bit more back into your court, I mean, do you think austerity was one of the causes of the current social care crisis we're in? I mean, looking back, is that something?
No, when I became Prime Minister in 2010, we faced a very difficult economic situation. We were forecast to have the biggest budget deficit anywhere in the world. It was forecast to be over 11%. The decisions that we took wasn't a sort of voluntary choice that we sort of opted to do difficult things in terms of spending. We thought it was the only option to try and make sure that our economy was stabilised and then went on and grew, which it did. And, you know, by 2013, 2014, we were the fastest growing economy in the G7, and the country was doing well. And all the way through that, we protected the NHS, and the NHS had real-term spending increases all the time I was in government. But did we solve the problem of funding social care? No, we didn't. The deal not cap came forward as an idea, and the reason we didn't go ahead with it is whenever you looked at taking that money out of general taxation, you were effectively asking less well-off people to pay their taxes to support better-off people to keep their houses. And my wish is, as I say, we should look again at insurance-based options, because that might be the right answer to stop people having to sell their home to pay for care.
You were Prime Minister when Vladimir Putin annexed Ukraine. What would your advice be to those negotiating with Russia at the moment?
Well, I think the first thing is I completely support the very strong stance the UK and the US government has taken against Putin. I mean, if you go back to 2014, we were the government that saw it as an invasion, and it was because of Britain that the asset bans and the freezes and the sanctions were put in place. And I remember fighting for them very vigorously in the EU Council when a number of other countries were saying, well, it's a bit more complicated. Are we sure it's really an invasion? It was an invasion. And what has happened subsequently is even worse. So I think the first thing is for the government to keep up its staunch support. Now, of course, we'd all like to see an end to this conflict. We want to see Ukraine's borders properly restored. And I don't want to sort of comment in detail about that, because I'm sure there are all sorts of discussions going on that should be going on. I think the most important thing is not to get out in front of and undermine in any way President Zelensky and the Ukrainian people, who've shown such bravery and courage at this difficult time.